to all of you here. Welcome to the World Congress on Primary Healthcare and Medicare Summit in Vienna, Austria. First of all, I would like to thank you for inviting me to this conference. I'm very honored actually to accept this invitation. So before I begin my presentation, allow me to introduce myself first. My name is Roziah Sidik from Research Center for Arabic Language and Islamic Civilization, Faculty of Islamic Studies, Universiti Kebangsaan, Malaysia, or in English we call it the National University of Malaysia, the only national university in Malaysia, right? Okay, my involvement in this field first began with a research sponsored by the Malaysian Ministry of Higher Education from the year 2016 to 2019. I was researching a music therapy based on the medical practice of the Islamic civilization. Then I was able to get two postgraduate students as research assistants for it. One of them was a master's degree student whose research focused on music therapy during the Abbasi period, and the other student was doing Doctor of Philosophy research focusing on the epistemology of music therapy and its application at the Bimaristan Al-Mansuri in the 13th century. Both of them have since then graduated. At the end of the year 2020, I then continued the research on music therapy and was fortunate to get a new research grant. This time, my focus was on application of music therapy in treating mental health patients, mental health of students at higher education or higher institutions of learning due to the COVID-19 pandemic. We realized that this pandemic not only affected adult people but also students. So students, especially university students, have to study online, cannot go physically to the library or even laboratory to do research. So this affect their students' life. They worried about their study, time is running out and they cannot do anything. So my research focused on looking at their status of mental health and how music can help them in dealing with the situation. In terms of writing, I published many articles related to music therapy, such as epistemology and philosophy of music in the Islamic civilization, impact of music therapy on mental patients, analysis of philosophical understanding sources on music therapy in the Middle Ages of Islam, music therapy as a complementary treatment in Bimarastan Al-Mansuri during the 13th century, the development of music therapy in medieval Islam from the 9th century to the 16th century. So that was a little bit about my involvement in research on music therapy. Hopefully my sharing today will spread the knowledge and bring benefit to many parties, especially in the current state of the world, facing the COVID-19 pandemic adversely affecting human mental health. Music therapy indeed may not wholly solve this problem, but where there is space, it can help to relieve pressure and better manage mental health. So for today presentation, I will talk about introduction, the concept of music therapy, how Islamic civilization institutionalized music therapy as a line of treatment, application of music therapy in medicine of Islamic civilization, and finally sorry I will conclude I will conclude the presentation. Right. Historically, music as therapy was used in many world civilizations, such as ancient Egypt, ancient China, ancient Greece, Rome. In this case, Al-Farabi held the view that the ancient Egyptians were pioneers in the field of music. It then spread parallel with advancement in the field of medicine until music therapy played a significant role in the life of ancient Egyptian society. Technically, music was played prior to medical treatment as it was believed that it had extraordinary power of healing. Likewise, it was frequently used for women in labor. If we look at ancient Chinese civilization, we will find that various levels of society were certain that music was very beneficial to human life. For example, Confucius, the famous Chinese philosopher, I believe that you all know him very well. He once said that music could improve the clarity of human vision, sharpen hearing, promote blood circulation. And Confucius also considered the art of music as a symbol of civilization based on his words. If you wish to know the progress of a nation, then listen to their musical compositions. That was what Confucius said about music as a symbol of civilization. Apart from Confucius, we also have other Chinese scholars who were convinced that music was good for humans, such as ensuring healthy living, um, creating a calm ambience, and relieving feelings of sorrow. One of the Chinese emperor, for example, was convinced that properly composed music could arouse feelings of tolerance, compassion, pleasure, courage. So this means that music is capable of affecting human emotions. They also believe that the use of particular music instruments, for example, help to expel uh, bad spirits and restore good spirits. In this respect, the ancient Greeks were similar to these civilizations. They believed that music could play a significant role in dealing with physical, dealing with mental, and also dealing with spiritual health issues. For example, a scholar named Koch reported that a Greek poet named Homer, who lived in the 9th century before century, mentioned the capability of music therapy to help bleeding, thus making it very appropriate for patients undergoing surgery. Pythagoras, who died in the year 495 before century, also suggested that music therapy be applied to a person experiencing disappointment and to hot-tempered persons. So let's say you are now experiencing disappointment or you are a hot-tempered person, then try to listen to music, see what happened to your emotion. But no need to try it now, you can try it later, okay? Right, going back to Pythagoras, he even believed that music therapy was very effective to treat disease caused by hormonal disturbance in the body. In fact, according to Burnett, one of the modern scholar, he said that Pythagoras practically applied music therapy to an intoxicated youth from Taormina, located in Sicily, to regain his sanity and repose. Besides the ancient Chinese and Greek civilizations, music therapy was also practiced as a treatment method in the Roman civilization. Roman used it as Roman used it to assuage grief, to overcome hysteria, to ease stinging pain from poisonous insects, to fight disease caused by microbes, and also to treat mute persons. It was also applied to individuals suffering from psychological disorders and also to deaf persons. I once come across a research conducted by Further Bell and Condi, where they said that it was also used to treat severe mental disorders of afflicted persons such as chronic anxiety. And Romans believed that music therapy alleviated pain, strengthened the vital force of or energy or life energy, and increased perseverance. So we can see here that music therapy is applied across civilizations. As a conclusion, I can say that music therapy was applied in many great civilizations of the world. I have not yet touched on its application in the Islamic civilization, but it is going to be quite a long discussion on music therapy in the Islamic civilization later. Now, in terms of the concept of music therapy, I refer to several associations, especially related to music therapy. We can find many definitions actually on music therapy. You can just Google it. But what I'm sharing with you today is the view of the American Music Therapy Association, or AMTA, which defines music therapy as the clinical and evidence based use of music interventions to accomplish individualized goals within a therapeutic relation shaped by a credentiated professional who has completed an approved music therapy program. Another definition is by the World Music Federation Therapy, who defines music therapy as the professional use of music and its elements as an intervention in medical, educational, and everyday environments with individuals, groups, families, or communities who seek to optimize their quality of life as well as improve their physical, social, communicative, emotional, intellectual, and spiritual health and well being. Research, education, and clinical training in music therapy are based on professional standards according to the cultural, social, and also political context. Other than that, there are also several definitions of music therapy, such as therapy based on musical activity, using music as therapeutic element to reduce anxiety, improve cognitive functions, hasten the process of recovery, and help increase the level of interpersonal communication. Also, we can define music therapy as using music as a source of relaxation and as prescription to maintain and improve emotional, physical, physiological, and spiritual health. Based on the given definitions, it can be concluded that music therapy is a method to improve a person's emotional, physical, and spiritual health. It is not limited to the use of particular instruments, but also includes call to prayer, recitation of Quran, sounds of nature such as flowing water, singing of birds. But its use is more toward complementary treatment applied with the main treatment, meaning that it is not the main treatment but applied together with the main treatment. The main treatment usually involves medication, surgery, and music therapy is complementary, like aromatherapy, bath therapy, listening to story, dance presentation, and theater, and so on. Now, how Islamic civilization institutionalized music therapy as a line of treatment. What Islamic civilization did in applying music therapy was by institutionalizing it, meaning that Islamic civilization put the responsibility of applying music therapy into the hospitals. That was why research on Islamic civilization shows that many hospitals in the Islamic civilization applied music therapy as one of the treatment methods. Among the hospitals were Bimarastan Fez in Morocco. This hospital was built by Yusuf bin Yaqub. It was the prototype for the Psychiatric Hospital Valencia, Spain in the year 1410. And in this hospital, patients who experienced this depression were treated with music therapy, treated with herbs, and also a variety of spices. Right, these are the photos for the hospitals. Okay, for Fez Hospital, it is actually no longer exists. I visited Morocco 2 years ago in 2019. I got the opportunity to take a few photos of the original site of Fez Hospital. It is now a bazaar where people sell handicraft, souvenir, and so on. Other hospitals were Bimarastan Al Mansuri in Cairo, Egypt during the Mamluk era. It was built by Malik Al Mansur Saifuddin Qalawun, and this hospital entertained patients with soft tone music. It also has a special allocation provided for a group of musicians to come and perform every day. In this hospital, insomniac patients were placed in a separate hall while being entertained by very harmonious melodies. Next, we have Bimarastan Al Aruni in Aleppo, Syria. This hospital was once a palace, which was modified into a hospital by the governor of Aleppo. It functioned as a hospital until the 16th century. Interestingly, this hospital provided a special stage for musicians to entertain patients, especially mental patients, so that they would be more restful, more cheerful. And the musicians were paid salaries from a special allocation provided for hospital expenditure. Most of the physicians suggested music therapy as treatment for patients suffering from depression symptoms. Music therapy here not only used instruments and singing, but also included melodious recitation of Quranic verses every morning and evening. Usually, music therapy was applied with other therapies, such as listening to stories, watching dance performance, and also theater presentation. Next, we have Bimarastan Nuruddin in Damascus. This hospital provided music therapy as treatment for mental and physical disease. Currently, it is no longer exists. It was transformed into a museum for history of Arabic medical science. Another hospital is Kayseri Gevernasibeh Darusshifas. This hospital is considered the first health institution which applied music therapy in the Seljuk Anatolia period. Usually, music therapy was applied to mental patients, whereby singers and musicians performed 3 times a day in the middle section of the hospital, which was directly connected to the patient's ward via the balcony. This hospital was then modified, and it is currently a museum for history of medicine at the Kayseri Gevernasibeh Faculty of Medicine. So the hospital is no longer exists. Moving on to another hospital, we have Tifriki Ulumos and Darusshifas, which was built by Turan Malik. The hospital building is currently a UNESCO World Heritage Site. Next, we have Amasya Darusshifas. In this hospital, music therapy was used on mental patients, whereby they went through therapy sessions to the sounds of musical instruments and also of water. Another hospital is Fateh Darusshifas Istanbul, which was the first Darusshifas built in the Ottoman era. It contained 70 rooms and had 80 domes. In this hospital, music therapy was also applied to mental patients from the year 1824. We also have Edin Sultan Bayazid II Darusshifas. This hospital offered treatment services for mental patients as well as eye patients, but music therapy was specifically applied to mental patients. Okay. According to Senggul, who is a modern scholar, music therapy in this hospital used the sound of instruments, and also the bubbling sound of flowing water from the fountain pool, producing a therapeutic effect. The combination of these sounds increased relief for the patients. Music therapy service in this hospital was considered as having reaching its peak in history because it was systematically implemented through music concert performances thrice weekly by a group of 10 members. Three of them were singers and the rest were musicians. One of the musical instruments frequently used was oud. We also have Sulaiman Yehesif Hadisi. It was built by the architect Mimar Sinan by order of Sulaiman the Magnificent. This hospital provided music therapy through a special unit, namely the neurological unit. Music therapy service was provided until the middle of the 19th century. And another hospital established was by Aisyah Hafsah Sultan, mother of Sulaiman the Magnificent and the wife to Sultan Salim at Manisa. It was quite small in size, but nevertheless provided music therapy treatment for mental patients until 19th century also. Currently, the hospital building is a museum, so as a hospital, it is no longer exists. Now, what I can conclude are, firstly, music therapy was institutionalized. It was applied intensively and extensively in a hospital, not in a private place. Secondly, music therapy was intensively and extensively applied, especially during the Seljuk and Ottoman eras, as most of the hospitals offered this treatment. Thirdly, the patients most often treated with music therapy were mental patients and those suffering from psychological disorders such as depression, insomnia, and also melancholia. Fourthly, besides using musical instruments, music therapy was applied using singing, call to prayer, recitation of Quran, and also sound of water. And finally, the functions of music therapy were to entertain, to soothe, and also to relieve pain. We move on now to the application of music therapy in medicine of Islamic civilization. At this point, I will describe the process applied at Pimarastan Al-Mansuri. The usual procedure for a patient before admission to a ward was to undergo a preliminary examination by an assistant or trainee physician at a polyclinic located at the southern part of the hospital. Should the patient require treatment, he would be advised to be warded so that his level of disease or disorder may be monitored all the time. The main procedure before admission to a ward was to process of registration. The registration record would then have to be confirmed by the chief physician. Upon confirmation, the ward for the patient would be determined based on the gender. There was a segregation of warding between male and female patients, with only male nurses on duty in the male wards and only female nurses served female wards. Nurses constantly gave their best service to warded patients, such as serving medication and meals, taking care of bedding, clothing, and also bathing patients. In the context of treatment by music therapy, every night a music band performed to entertain patients by playing the musical instrument known as oud. Patients who were often given direct therapy with music melodies were insomniac patients and also rehabilitation patients. They went through the therapy process in a room specially provided by the hospital. Nevertheless, the musical melodies could also be heard by patients in other wards. Thus, music therapy was indirectly applied on all patients, whether mental or physical, through the sounds of nature and also human voice, like chanting of azan and recitation of the holy verses of Quran. The implementation of music therapy at Bimarastan Al-Mansuri is seen as conforming to the epistemology developed and disseminated by Al-Kindi, Ibn Safa, Al-Farabi, and also Ibn Sina. For example, Al-Kindi applied music therapy to an apoplexy patient using the oud to give him temporary relief before he passed away. Likewise, Al-Farabi managed to influence the psychophysiology of listeners by plucking on his stringed instrument, triggering various different emotional effects. These scenarios shows that music therapy has its own capabilities, specifically in the context of alleviating pain, assuaging symptoms, hastening healing, and also maintaining health levels. So to conclude the presentation, I may say that the application of music therapy in Islamic civilization took place institutionally, meaning that music therapy as a method of treatment is carried out in hospitals, not in a private place. By institutionalizing it, it gives an advantage to this method of treatment as it can be carried out in an orderly and structured manner. The hospital also has a wakaf fund to ensure the continuity of this method of treatment. Even the existing hospital design and landscape also greatly helps the application of this method of treatment. So I will stop my presentation here. I really hope that it will benefit all of you. Should you have any queries regarding music therapy, especially in the Islamic civilization, please do not hesitate to contact me. Thank you very much for your attention.